بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. Welcome in our case of the week 8 at our channel 4D Passion. This is a case referred to my center for second trimester anomaly scan due to marked oligoamnios. The first scene loop shows oblong shaped skull reflecting scaphocephaly. Scaphocephaly is the same term as dolichocephaly. You will notice the significant ventriculomegaly, the bilateral lateral cerebral ventriculomegaly, and the cystic posterior fossa with missing cavum pellucidum at this fetus of 18 week plus 2 days gestational age. The lateral view shows the cystic posterior fossa with elevated torcular hierophily with intact occipital bone denoting absence of cephalocele. The fetal kidneys are significantly enlarged and polycystic. And the ribs are significantly short. A normal rib will reach to the apex of the heart. This rib is markedly declining beyond the level of the apex of the heart. And on a profile view of the fetus, you will notice that the chest is small, bell-shaped compared with the fetal abdomen. Again, the fetal kidneys are significantly enlarged and polycystic. Here is a cine loop to show that the fingers of the baby are of normal count and there is no polydactyly. Also, cine loops of feet shows normal finger count, but not shown here. Mild to moderate shortening of the femur length compared with other biometry is noted. The femur length is at 17 weeks gestational age. Here is the image series. Significantly enlarged polycystic fetal kidneys, bilateral. The fetal urinary bladder was non-visualized along the study, as well as on follow-up 30 minutes later. The scaphocephaly with the ventriculomegaly and cystic posterior fossa. The cephalic index was significantly diminished at 61%. Normal is 70 to 86%. And the cystic posterior fossa again. The fetal heart was normal. The short femur. And the gestational age according to other, this is the humeral length was at 18 weeks. And the biometry of the fetus shows significantly mild to moderate shortening of femoral length that is at 1.5 minus 1.5 standard deviation. And here is a small, the chest circumference to the abdominal circumference was also diminished at about 60%. The normal is 80 to 100%. And the significantly short rib should reach to the level of the apex. And this is an example of a normal case. You will notice that the rib ends at the apex of the heart. And here is an image of the marked oligoamnios. Also, you will notice there is a hypertelorism. Actually, when this eye and this the other globe, you will normally put another globe in between, but here you can put easily two globes, denoting that the interocular distance is increased and there is hypertelorism. Again, the cystic posterior fossa with elevated torcular hierophily. So the findings are short ribs, small thorax, mild to moderate shortening of long bones, bilaterally enlarged polycystic kidneys, hypertelorism, bilateral lateral cerebral ventriculomegaly, cystic posterior fossa with elevated torcular hierophily, reflecting a Dandy-Walker malformation, oligoamnios. When we searched OMIM by the following findings: short ribs, short bones and short ribs, and small thorax, and the enlarged kidneys, and the scaphocephaly, and the hypertelorism, and cystic posterior fossa. Only one entry was achieved, that is short rib thoracic dysplasia 9, with or without polydactyly. When we changed the search into polycystic kidneys and scaphocephaly and short ribs, short bones and cystic posterior fossa, the same entry was achieved. When we changed also the search into polycystic kidneys and scaphocephaly and short ribs and cystic posterior fossa, the same entry again. And also with polycystic kidneys and scaphocephaly and short ribs and small thorax and cystic posterior fossa, the same entry was also achieved. So the diagnosis is short rib thoracic dysplasia with or without polydactyly 9, best matching with Mainzer's saldino or cone-renal syndrome. Short rib thoracic dysplasia with or without polydactyly refers to a group of autosomal recessive skeletal ciliopathies characterized by a constricted thoracic cage, short ribs, shortened tubular bones, and a trident appearance of acetabular roof. Short rib thoracic dysplasia encompasses Ellis-Van Creveld syndrome and the disorders previously designated as Jones syndrome or asphyxiating thoracic dystrophy, short rib polydactyly syndrome, and the Mainzer-Saldino syndrome, which is best matching in our case. Polydactyly is variably present, and there is phenotypic overlap in the various forms of short rib thoracic dysplasias, which differ by visceral malformation and the metaphyseal appearance. Non-skeletal involvement can include cleft lip palate as well as anomalies of major organs such as the brain, eye, heart, kidneys, liver, pancreas, intestines, and genitalia. Some forms of short rib thoracic dysplasias are lethal in the neonatal period due to respiratory insufficiency secondary to a severely restricted thoracic cage, whereas others are compatible with life, like in our case Mainzer-Saldino syndrome. Mainzer-Saldino syndrome or cone-renal syndrome is a ciliopathy caused by homozygous or compound heterozygous mutation in the IFT140 gene on chromosome 16p13. Various organ system manifestations in Mainzer-Saldino syndrome include height, short stature, head and neck, microcephaly in some patients, trigonocephaly, scaphocephaly, face, frontal bossing, prominent forehead, bitemporal narrowing, eyes, retinitis pigmentosa, nystagmus, and visual loss, and mouth macrostomia, high arched palate, bifid uvula, macroglossia, multiple oral frenula, wide and irregular alveolar ridges, teeth, widely spaced teeth, small teeth, square teeth, chest, small thoracic cavity, and short ribs, liver cholestasis, hepatomegaly, hepatic fibrosis, and genitourinary chronic renal failure, nephronophocytosis, renal cysts, sclerosing glomerulonephritis, and skeletal craniosynostosis in some patients, limbs, small femoral capital epiphysis, flattened femoral epiphysis, short femoral neck, metaphyseal defects in some patients, and hand short fingers, cone-shaped epiphyses, feet, cone-shaped epiphyses, and neurologic cerebellar ataxia and cognitive defects in some patients. The take-home message: in early oligoamnios, your checklist should include assessing kidneys, looking for cerebral anomalies and excluding cephaloceles, assessing size of the thorax and ribs, counting fingers, and looking for facial clefts or other skeletal anomalies. Though technically difficult exam due to oligoamnios, yet careful search for anomalies will increase detected findings, and this will help to the genetist and also save money. Now he can do a gene panel targeting the responsible gene and not a whole exome sequence. OMIM is an invaluable site that will help you so much in solving syndromic cases. Always, the more the detected sonographic findings, the shorter list of possible diagnoses you will get on OMIM. Kind regards and see you soon. Assalamu alaikum wa rahmatullahi wa barakatuh. Dr. Amr Farouk.